Hey everyone, I'm Dr. Jaydee Romick, and today we're here to talk about how we have more power over our health than we think. I'm really excited to bring you our first guest today, Dr. Kim Eppen. I will let her give kind of an intro, but she is also a faculty here at George Fox. And the first time I met her, she was giving a lecture on chronic illness, pulmonary, physical therapy. And I'm very excited because she's brilliant, but also going to share some of her wisdom from her field today.
Oh, so, thanks, Jaydee.
Yeah. Kim, tell us a little bit about yourself, your passions, what you're doing.
Well, I'm Kim Eppen, and I'm here as your guest to share and hopefully give you all some tips today on how you can maybe better manage your health and realize how much more control over your health you think you have, or you may know that you have. As Jaydee said, I'm a physical therapist. I've been a practicing physical therapist for about 29 years. The bulk of my career has been centered around working with people with chronic disease, specifically pulmonary disease. But a lot of these people have a lot of other chronic diseases. Most of my experience has been at a large Midwestern hospital, tertiary care center. See people with pretty severe diseases. And I've been an adjunct clinical faculty professor at the University of Iowa for many years, and also I was blessed enough to get a position here at George Fox University as an associate professor of physical therapy as well. And so I get to come out here a couple times a year and teach and spend time with other people and spread the word about physical activity, health, how your health matters, and things that you can do about your health. Yeah. I've personally been a lifelong exerciser, so it's a joy and pleasure for me. It's in my DNA to come and just share how important physical activity is for your health and just leading a healthy lifestyle and what that can bring to you.
Yeah, no, I love that. And you also got your PhD, is that correct?
Yes.
Okay, it's amazing. So just thinking about the state of the world, I'm actually in the field that I am because I felt like physical therapy could make a huge impact in the epidemic that we're facing of chronic health conditions. They impact majority of Americans. We've got cancer, cardiovascular disease or heart disease, stroke, diabetes, obesity, arthritis. I know I'm missing some in there, but these chronic health conditions cost billions, if not trillions of dollars a year. You probably have more data on that than I do, but it's a huge epidemic. Yeah. And I have recently learned, though, a lot of these are preventable and they're kind of tied in with our behaviors. Can you tell us a little bit about that relationship?
Yeah. There's so much truth behind what you said. Several years ago, I went through a clinical health coach training specifically for chronic disease management because it's so prevalent. And the traditional medical model really has evolved in a way where it's become designed to really help to manage chronic disease. It doesn't cure it, but just kind of helps to manage it. One of the things I learned in that course was something called the 80-80-80 rule. And what that said was that 80% of healthcare dollars are spent on chronic illness. 80% of those dollars are spent on high cost, often preventable services like hospitalizations and emergency department visits. And 80% of healthcare is self-care, the majority of which takes place in the bedroom, the kitchen, and the bathroom. Wow. And when I heard that, I was just like, wow, like that is amazing. It really does show how the healthcare system has really become a chronic disease management system, and that we have much more control over our health than we may think or know, because what we do most of the time is what matters. And so it really is the daily things that matter. Less than 2% of diseases are really due to some sort of genetic mutation. The thought is that most of what impacts our health and our health resilience is related to epigenetic signaling from our environment and the things that we do on a daily basis. Wow. So when you start to think about the environmental exposures that you have, what does your house look like? What does your office space look like? Like, where do you spend most of your time? What does your bedroom look like? What do you do in the kitchen? What do you do in the bathroom? All of these things, the signaling that you get from your environment. Are there toxins in your environment? What is the air that you breathe? What is the foods that you're consuming? Yeah. All of those things impact your overall health and your health resilience. And then our behaviors, other things, that's just the environmental
Wow.
things. But,
Yeah.
but what are you doing? How are you sleeping? What are your relationships like in life? What's your emotional status? What's your mental health status like? Are you happy? What is your, mental predisposition? Do you exercise? How much do you move a day? Less than 78% of Americans get the minimum amount of physical activity that's recommended a day just for general health benefits.
Wow.
So that's a really small percent of people that are actually moving as much as they should or could to really help to manage or prevent some of these chronic diseases that you mentioned. And it's also been estimated that about we spend about 13 hours a day sitting.
Yeah.
And that's a huge part of our day. And that's being inactive. And so
Yeah.
when you start to hear these things, you start to think about okay, what am I doing? Of course,
Yeah.
I start to reflect on what am I doing? What's my lifestyle like, And you start to look around and you start to see how those things may be impacting a lot of the patients that we're seeing. We're privileged enough to have an opportunity to work with people and walk with them in their most vulnerable states. And I take that very... I view that as a privilege,
Yes,
and so
absolutely.
creating that safe space for people to come and have an opportunity to help people and know what kinds of things that people maybe can be doing to help improve their overall health and to be able to share that with them. So
Wow.
I'll pause here and let you chime in.
I was going to say, you just said so much that I feel like we need to unpack, or that we could unpack. First and foremost, that our health care system seems more like a sick care or an illness care system, where we're really just managing these people that come to us. And, I love doctors. I love medical doctors. They have so many tools, or only so many tools, that can help with these illnesses. And, I'm a big supporter of Western medicine, but that is staggering.
Yeah.
To be able to manage all of those facets, all of those different... And I really want to get into what types of behaviors can lead to that, but not only managing the person's illness, but then their life.
Yeah. Well, interesting, and I don't mean to interrupt you, but chronic disease really is a condition. If we look at the definition of what chronic disease is, it's a condition that lasts, something that lasts for greater than or equal to 3 months, that can't be cured by a medication or a vaccine.
Wow.
So once again, that is the CDC's definition of what chronic disease is. So it can't be cured by medication. What does medication do? It helps to manage maybe a condition or keep the symptoms at bay. But these behaviors, these things that we have more control over, or the things we do on a daily basis, those have probably the greatest impact on our health and overall well-being.
Yeah. That gives me hope, what you just said, because the other thing I wanted to impact is, you said less than 2% of conditions or our genetic makeup has less to do with it than our behaviors and our environment, which is empowering, because the amount of patients I get that say, oh, my dad had such and such, so I'm going to get such and such. That's powerful, because that instills a lot of fear in people. So that the fact that we have more control is really powerful.
Well, I think that, people can have a genetic predisposition to possibly getting something, but if you have a genetic predisposition, or you have a family history of something, knowing that the behaviors that you do, the activities you engage in, the things you put in your body, the amount of sleep that you get, all of those things can work in your favor or work against you. And those are choices that you have. And so knowing that you have more power over your health than you think, or you may know, you may be able to mitigate the chances of you developing a full-blown disease by doing things that maybe are in your best interest from a health standpoint, if health matters to you.
Yeah.
And then that's the choice everybody has to make, because health may look or feel very different for different people. Health isn't just the absence of disease. It's really a state of complete social, physical, and emotional well-being.
Yeah. Wow. And that's true. All aspects of your life kind of have to be in balance for you to feel optimal health, or at least in my experience and majority of my patients' experiences, it's rarely just one thing. And it all folds in, which I think makes it even more complicated to try to treat folks like this, or maybe be an individual that is battling a chronic illness, because you don't always know the root cause, but controlling all the things that you can, which is really what I hope to get out of this conversation today, is I want to know what we can control. But I feel like you may have wanted to say something in the middle of that diatribe.
No, I was just listening to what you're saying.
I was like,
I guess one thing I want to say is we talk about being in control of your health. Like, ultimately, God is in control. So I don't want us to think that, we have the ultimate control, but I guess the point that we want to make here, I guess I should speak for myself, is that if health is something that matters to you, then there are things that you can do to optimize your state of health and well-being.
Yeah. And
really, that's what we're trying to, I guess that's the message that I'd like to get across. Or what are some of those, the biggest contributing behaviors that have been shown to be linked to chronic disease? And those are tobacco use, poor nutrition, and lack of physical activity. So those are the three big ones, but then there are other things that can be considered into that overall health equation, and that include like relationships, like I said, physical activity, your emotional or mental well-being, sleep, making sure that you're getting enough sleep. I can't emphasize the importance of that enough, and that may be a topic for another episode.
We're absolutely going to bring that back.
Something that's near and dear to my heart. I did my dissertation work in that, and people with obstructive sleep apnea. So breathing, how we breathe matters. Bringing oxygen into our system. We're aerobic beings, and how we breathe matters. Meditation. So all of those things really, I think nutrition's huge. So all of those things really can have an impact on your overall health and well-being.
I love that. So if we're talking about these behaviors, you mentioned, sedentary behaviors, smoking, and nutrition being kind of the top three. Let's unpack those a little bit. We mentioned already, like our day-to-day, you sit for 13 hours. So this was a revelation I had a few years ago, is that, we commute to work. Maybe you have a short commute. That'd be great.
I ride my bike to work.
And if you're
not from Iowa to Oregon, but
but if you're blessed to live close, if I didn't have a 30-minute commute, you better believe I would be
judgment-free zone here. I'm just saying.
Right. No, but I love that. I would love to be able to ride my bike or walk. Like that would be a dream scenario. But a lot of people commute. Sure. Then they sit or have a sedentary job, or they, then they have lunch. Maybe they eat at their desk because they have so much work to do, or they sit with colleagues and eat. Then it's work, then commuting. Maybe you get an hour of activity in if you stop by the gym.
Yeah.
Then you sit at home after a long day of mental exhaustion and you just want to relax. So you're sitting on the couch watching the newest Netflix or Amazon Prime show. We're not sponsored, by the way, but just, you know how the American lifestyle is. Yeah. So it's staggering. Like, how do we overcome that? And I know that's a big thing to unpack, but sedentary behaviors, what do we need to do?
Yeah. Well, first, let's kind of look at what the CDC recommends for just general health benefits, because there are some benchmarks that we can strive for that have been shown to kind of decrease your risk for chronic disease. So the CDC recommends that you try to get at least 150 minutes of activity per week at least a moderate intensity. So what does that mean? A moderate intensity? Well, that would be a brisk walk, something that kind of makes you short of breath. If you want a quantifiable benchmark, it would be walking at about 3 miles per hour. If you can't walk at 3 miles an hour, then you walk at whatever pace feels like it's at a brisk pace for you, and then work up to maybe reaching that 3 mile per hour pace. But at least 150 minutes per week, or if you're able to exercise at higher intensities, about 75 minutes per week. And I'm talking about endurance type exercise. So sustained, if possible, physical type of exercise, which would include something like walking, biking, anything that kind of sort of gets your heart rate up. Yeah. Now, obviously, there are greater health benefits if you do more exercise. So greater health benefits, the goal would be 300 minutes per week of moderate intensity exercise, or more like 150 minutes per week of high intensity exercise, or it can be a combination of those things. So those are kind of sort of just some baseline benchmarks to strive for general health benefits. Obviously, if you're looking to be a more competitive athlete, or you're trying to improve your cardiorespiratory fitness, then higher intensity and longer durations matter. Resistance training exercise also. You're the resistance training expert. I'm gonna like hand off to you. What are the recommendations? Or what would you recommend, Jaydee, Dr. Romick?
What I would recommend as a minimum. So, a couple days of strength training, hitting every major muscle group, and you should feel like it's exerting yourself. I know, throughout the day, you're moving things around, lifting, but it's that intentional lift. A lot of my clients that I have will have their younger, their children lift things for them, their grandchildren, their spouse, and not just targeting females here or anything, but as soon as we give up kind of our independence of lifting things for ourselves, pushing ourselves off the floor, we take that for granted being young and healthy people. But as we age, it's amazing how this decrease in muscle mass really impacts our longevity. So if you can strength train a minimum of 2 days a week, working those major muscle groups, getting your heart rate up a little bit, you don't need to be exhausted, you can't breathe, but stressing the system so that is more robust for your future. And lean muscle mass is a great predictor of longevity as well. So that's striking to me that, we're not going to get big and bulky and scary, but actually our life expectancy, our vitality is expected to increase if we have more lean muscle.
Yeah.
So I can't recommend it enough.
Yeah.
I always challenge my female clients to lift things as much as they can, get down on the floor and push themselves up a few times a day, really challenge themselves.
Yeah. And those are really good practical tips. Like you said, muscle matters. It really does. I think so many people think, well, it's part of the normal aging process to just lose your muscle mass. Is it really part of the normal aging process physiologically, or is it because as we age, we stop doing a lot of the things that we were doing earlier on in life that built muscle?
I would agree with the latter.
Exactly.
Honestly.
And so doing those things, and I think sometimes people are more fearful, like, oh, I might hurt myself if I do this. Well, using improper body mechanics may lead to injury, but maintaining your strength and doing things the proper way.
The more you test the system, the less variability you have day to day, and you'll be able to avoid falling or you'll be able to avoid those injuries.
There's a lot of data out there to show that decreased quadricep strength is one of the greatest predictors of falls.
Yeah.
And so quadriceps being your thigh muscle. So there are simple exercises that you can do to help strengthen your quadriceps. You don't have to go to a gym and use heavy weights or anything, just doing a repetitive sit to stand exercise.
Yeah.
Or seated knee extensions, getting ankle weights and straightening out your legs. So you don't have to have a lot of sophisticated equipment.
Totally.
The CDC, just to kind of go back to some benchmarks of recommendations for general health benefits for resistance training, would be 2 days per week. At least one exercise, if not two, for some of the major muscle groups of the body.
Yeah.
So like your chest, your back, your legs, your arms, things like that. And so if you're not familiar with the types of exercises you should do, consulting with a physical therapist, we've got one right here.
Go see your PT. Hey, come see me.
And sometimes, personal trainers, there's information out there, but that would be recommended 2 days per week, non-consecutive days if possible. And that would be just the minimum for resistance training to get the strength training benefits.
Yeah, I would argue that, we do need more movement than less. I think we see in the data that there are deficits if you work out for longer than 6 hours a day. Like, that's not good for you to exercise at 6 hours of moderate to vigorous intensity activity, but many of us aren't getting quite 6 hours day in, day out, without recovery, without rest.
And if we circle back to what we talked about in the very beginning with the epigenetic signaling from what we do on a daily basis, it's those daily behaviors that matter most.
Exactly.
And so being a weekend warrior where you go out and you try to get this large bolus of activity, going to play basketball for 4 hours with your buddies or, and I'm not detracting from that.
Totally.
It's really, those are great activities, but it's the everyday things that matter most. So if you're sedentary for 5 days a week and then Saturdays are your day to go out and do your exercise, you can't just backfill those activity, the lack of activity during the day. So it's those long sedentary periods of time that affect your physiology. They decrease your metabolism. It leads to decreased breathing depth and frequency, which has to do with your lung health and your overall, just basic overall health. And once again, we can talk about that. There's even something called email apnea now. That's actually a term where people get so engrossed with what they're doing when they're sitting for prolonged periods of time, their breathing actually starts to become more shallow.
Oh, wow.
And some of the negative health consequences they're finding are similar to that of people who have diagnosed obstructive sleep apnea. So cardiovascular disease, metabolic syndrome, arrhythmias, decreased insulin sensitivity. It just sets you up for a whole sequelae of things. And so be aware of that. Take deep breaths. But
we'll come back to that. I want to dive deeper in your breathing because that's important.
But as far as getting those physical activity guideline or the targets for physical activity in, probably the best strategy to do is to minimize all these prolonged sedentary periods of time throughout the day. So if you have a job that requires you to sit, and you may be thinking right now, well, geez, I work in IT, I sit most of the day, I get my half an hour in at lunch, and I'm good to go. I'm meeting that minimum, recommended 150 minutes per week. Keep in mind that's the minimum. And the amount of time that you're being sedentary, there are still negative, health implications associated with that. So if you can come up with strategies to get up and move around, even if you stand up, there's standing workstations now, walking across the room to talk to a colleague, rather than
Instant
email them
messaging.
or right. It's
Right.
like, or texting them. Like
Yeah.
the whole world is built around how can we make things easier for people, you
And
know?
more efficient, quicker.
And, you know, during the public health emergency and the COVID epidemic that we had where people were socially distanced, you know, that fed into the convenience. And thankfully we had a way to communicate with people because relations are so important. But I think a lot of people haven't gotten back to actually having human contact with other people. And that's really important for overall health and well-being and physical activity. Get up, walk across the room, talk to your colleague, have that facial interaction, you know? And, so there are ways that you can hopefully increase the amount of physical activity you're doing a day to add to the getting that total volume that's recommended, once again, just for general health benefits, recognizing that for most people, more is better.
Yeah.
The sooner in life you start exercising, the better, because you have health protective benefits from physical activity. So those people who start exercising and who exercise on a regular basis throughout the lifespan have improved quality of, well, it feeds into quality of life, but improved health status and health resilience, which is big. So that if you do develop an illness, your resilience to overcome that is greater if you're healthier.
That makes sense. And we did see that during COVID. That was very important to be, you know, to have really those positive effects of exercise. And I will say, you know, working with frail older adults, often they respond the same way to exercise. So knowing that it's not too late wherever you are.
And that, for me, like for spending 29 years working with patients who have chronic disease, and most of these patients are elderly, and many of them, I would say most of them, have been lifelong non-exercisers. And here you are telling them now that exercise is going to be probably the best thing that you can do for your health and well-being and improve your quality of life. And, you know, give this sales pitch. But, you know, you have to get people to buy into what you're selling. But once they start to see the benefits, the people who are the least fit, who have not been exercising, it's the smallest amount of activity that can translate into the greatest amount of quality of life, because you can go from being dependent on other people to gaining a little bit of fitness and mobility and strength. And that can then bridge you to being independent with things. And just think of how empowering that can be for an individual to go from,
That's amazing.
And so I get goosebumps just, you know, I think about like that's why I'm passionate about and blessed to feel like I've been called to do what I'm doing, and now being able to share that with other people too, you know.
It is amazing. And I would agree some of the biggest impacts I've had on folks are the ones that maybe they do have lower level fitness, and just empowering them with simple things like the sit to stands or going on a walk or doing a 6-minute walk test. It is so empowering to show them how much they've improved, and now they can walk to their mailbox, you know. And it goes for everybody, though. It's really depends on what's important to you. And if walking to your mailbox is everything and we can work to get there, amazing. If you want to do a half marathon, great. So, Kim, if we're talking about, you know, improving these chronic health behaviors, you know, nutrition is something we could unpack for another 30-minute episode. And working on smoking, of course, you know, cessation. I'm not an expert in that field, but if today we were to give our audience, you know, 3 top tips for this, you know, one step forward or making an incremental change in their life, you know, what are the 3 top tips you have for maybe it's improving movement throughout their lifespan, or maybe some closing thoughts you have, or anything?
Well, you know, I think one important thing is to recognize that what you do on a daily basis has the greatest impact on your health and health resilience and your overall well-being. So just, you know, pause for a minute and think about, like, what does a day look like for you? What do you do on a daily basis? And how that may be impacting you. What's your environment like? Do you have plants in your home? Is your house or the environment in which you spend the most amount of time, is that a happy, healthy, healing environment? And if it's not, are there things that you can do to help improve upon that? Because you're receiving signals from that environment that is affecting your overall health. So, you know, that would be the first thing, is what you do on a daily basis really has the greatest impact on health and your health resilience. Another thing is, you know, for people to define what health means to them. You know, what does it look like or feel like to you? Because what health looks like or feels like to me might be very different. I tend to think we're pretty similar.
Yes.
That's our bond. But
I know.
But like, what does it look like to you? And for somebody that might mean, being able to sit in my recliner and watch TV, but also be able to walk to the mailbox. Or like for me, I'm a cyclist. I've
Oh, yes.
and like being on my bike is my happy place.
Yeah.
I went for a ride this morning, and being from Iowa, where it's pretty flat and there's cornfields all over the place, to be able to have the joy and the God-given ability to like jump on my bike with my husband and go for a ride through the beautiful countryside here in Oregon, and to
amazing.
see, the vineyards and the tree farms, and it's just beautiful. So,
We're pretty lucky.
oh gosh, it's amazing. But like that brings me joy, and then that joy just spills over into the rest of the day for me. And so along with that, I would say, choose activities that bring you joy, and surround yourself with joy. And I don't know if anybody else here in the studio has any other tips or things they want to share about.
Caleb was talking about a run he went on before, and we'd love to hear about that.
Yeah.
Yeah, I took a run a couple of weeks ago, and I didn't want to go on the run when I started.
Mood follows action.
This is true. However, halfway through, I realized I was having a really great time, and I was acknowledging my legs work and my lungs work, and all of a sudden I just had a big smile on my face, and I was just worshiping God in that moment. And I didn't expect it to be worship, but it just came out of me. It's so, so beautiful.
Yeah.
Yeah. No, that's powerful.
Thanks for sharing.
Yeah. Thank you.
Yeah.
And I agree. I think the idea of exercise is always worse than the after effects. It's like, I don't want to move. It requires energy, and our bodies, I think, typically are wanting to maintain a homeostasis, but that stress brings so many good, healthy hormones, endorphins. It's amazing.
Yeah. And movement perpetuates movement. Motion is lotion, like our joints and our bodies were made to move. And so overcoming that sedentariness and just starting. And that brings me to, I guess, maybe the third tip. You asked for 3 tips. Doing something is better than nothing.
Yeah.
So if you're in a place in your life right now where if you're listening and, maybe you're thinking about starting an exercise program, or starting a movement program, or making some change in a behavior, think about what that next step might be, and give yourself permission to think like, hey, something is better than nothing. Let me move in a direction towards health in the way that I view health, what it looks like for me. And that was my second tip, is what does health look like or feel like to you? And how can you move in that direction? What kinds of steps can you take? And doing something is better than nothing. Starting something is like Caleb said, he went out for that run the other day. He didn't want to do it, but he did it. And it just, the joy that you get. And then when you choose activities that bring you joy, or fellowship with other people, that's another tip. It's like people who exercise together, who have an accountability partner, tend to stick with it longer, and that's a whole other topic. That
ties into social connectedness as well, which is super powerful.
Yep. So, rather than just having an activity like, I just need to check this off the list today. Okay, I did my 30 minutes.
Yeah.
That's great. You're meeting the CDC's, bare bone minimum recommendations for general health benefits. But like, is there something you could be doing that maybe brings you joy, that you can get more benefit from doing? And it doesn't have to be done all at once. That's the point I want to make. So dispersing your activity throughout the day, especially if you have a sedentary job, could actually bring you more health benefits than if you were sedentary all day long and then just got up and did your 30 minutes and checked it off the list. So
no, that's really important. And I mean, I'm taking notes even in my head of, are there times during my day where I notice that I could get up and move more, or incorporate more connectedness during my activity instead of making it a checklist. I think that's important too.
I think as a healthcare provider and somebody who's worked for so long with people who have chronic disease, especially people who have breathing dysfunctions, to see people who can't hardly breathe, whether it's COPD, asthma, pulmonary fibrosis, even some of the post-COVID sequelae that people experience pulmonary manifestations from or symptoms from. I've had the pleasure of working with pre and post lung transplant patients. It's a privilege, but to work with people who can't breathe, who wish they could, and throughout my career, hearing that message over and over again, Kim, do what you can do while you can. Don't ever take your health for granted. And thankfully, I've been a person that has never done that. I've been involved in sports and exercise. Like, it's in my DNA. I'm like a dog. If I don't get exercised every day, it's no good. Let me out of my cage. But hearing that from people who are maybe at a different point in their life, looking back, they would say to me like, Kim, go on vacation, go climb a mountain, go ride your bike, and then come back and tell us about that. Because I want to live vicarious through you, like to share that joy with other people who can't do that anymore. Like those are lessons that I've learned and I take seriously and then try to share that with other people so that maybe other people who value their health in that way can start adopting healthier behaviors and maybe not get to a point where dis-ease, the feeling of feeling discomfort, actually turns into disease.
Yeah.
Which is actually that, pathologic, physiologic change where it transforms into an actual condition.
Wow. Super powerful. I want to ask if you have anything else, but I feel like that was such an important note to leave on. But do you have anything else you'd like to share for our time today?
I hope anybody listening to this podcast, at least partway through, if you were sitting, you got up and moved around. And if you've been sitting, maybe you get up now and you move around. No, but we just, I just want to thank you first for inviting me to be a part of this and to be able to share with other people what we know works. Not only is there scientific evidence behind this, there's empirical evidence and personal evidence that movement does matter, as well as these other behaviors that we talked about. But letting people know that you have some control or management. We talk about chronic disease management. Management may mean the management is on the side of chronic disease where you haven't teetered over that point of developing the condition. You're managing your health and putting the health care back in healthcare where it should be.
Yeah, that's amazing. No, I love that. Thank you so much for sharing everything you have today. And I know we will have you right back on to talk about some of these other conditions and topics, but thank you so much, Kim.
Thanks.
This video podcast is a production of George Fox Digital. To find more material like this, you can subscribe to George Fox Talks on YouTube, Apple Podcasts, Spotify, or wherever else you listen to podcasts. Our team really appreciates your feedback in the form of likes, comments, and reviews, and we'd really love to hear what you think. To sign up for our weekly email list and to keep up to date with the latest episodes and publications, you can check us out on the web at georgefox.edu/talks. Thank you for listening, and we'll see you in the next episode.